The new CADD 250 milliliter medication cassette reservoir allows use of many CADD pump models for higher volume infusions while maintaining security without a lockbox. Each reservoir comes with integrated flow-stop free flow protection and an accessible drug bag within the cassette to aid in filling and removing air. This program demonstrates filling of the 250 milliliter reservoir, but is not a replacement for the complete instructions provided with each reservoir. Please refer to the detailed instructions for use supplied with the medication cassette reservoir for additional information, cautions, and warnings. Additional reference and support materials are also available from Smith's Medical. The CADD 250 milliliter medication cassette reservoir may be used with all CADD pumps except the CADD Micro, CADD TPN, and CADD MS3 models. Clear, blue, and yellow 250 milliliter cassette colors promote medication safety by helping users differentiate medication types. For example, epidural infusions in yellow, IV PCA infusions in clear, and blue for peripheral nerve blocks and surgical site infusions. Your institution can define your cassette color use based on your infusion needs. Open the package and place the medication cassette reservoir in an aseptic work area for drug filling. Remove the cassette cover by gently pulling the cover piece down to clear the top clips and away from the other housing section. Place the cover in the aseptic work area. Keep the blue clip in place for filling and transport of the filled cassette to the infusion site. The blue plastic clip allows the fluid path to remain open for both filling and priming prior to connection to the pump. Leave the blue clip on the cassette in place until the reservoir cassette is ready to be attached to the pump. Removing the clip prior to connection may affect delivery accuracy. Prepare the medication to be loaded to the cassette reservoir in a syringe with luer tip. Remove the luer protective cap and attach the syringe. Ensure the clamp is open prior to filling. Ensuring aseptic technique, inject the medication slowly into the reservoir bag to prevent microbubbles. Completely fill the bag with the medication and close the clamp in the middle of the tubing section. Gently squeeze the bag to expand the seams. Move the cassette gently to accumulate smaller bubbles into a larger air bubble in the upper portion of the bag. Create a single larger air bubble in the upper corner of the bag at its connection to the tubing. Open the clamp, then tip the cassette and use the syringe to withdraw all air from the bag. Repeat the process to collect and purge smaller bubbles if required. Close the clamp and visually inspect the bag to ensure all air has been removed. Cap the tubing luer with the non-vented red cap provided and reinsert the bag into the housing. Carefully align the cassette cover onto the housing using the position markers on their side edge. Take care not to pinch the bag with the clips on the cover or housing. Stand the cassette reservoir upright on a firm surface and use both hands to grasp the perimeter of the pressure plate. Press down firmly until the cassette cover slides up and clicks into place. Be careful not to press on the tubing, blue clip, or green spring arm. Properly assembled, the cassette plate is aligned with the housing to create a single protective housing. Once assembled, the housing is permanently sealed and cannot be opened without damaging the housing and bag. Do not attempt to reopen the cassette housing. Label the medication cassette reservoir on the housing following institution policy. Transport the cassette to the infusion site with the blue clip in place. The clip should only be removed just prior to attaching it to the pump. If the blue clip has been removed, you can depress the green spring arm to reopen the line to purge air or withdraw fluid.